The scapula plays many roles in shoulder and arm function. One of the main ones, it's a key component of scapulohumeral rhythm, the coupled motions of the scapula and the humerus to allow normal arm function. It also is a mobile but stable platform to optimize glenohumeral joint function throughout the full range of shoulder motion. It also provides a congruent socket so that it maximizes glenohumeral dynamic ball and socket kinematics, which then facilitates glenohumeral joint concavity compression. This video illustrates the ball and socket arrangement to make sure that the ball stays on the sea lion's nose. Other scapular roles include being a stable base for all the muscles that attach, the 17 muscles that attach to the scapula. It also facilitates activation and in the full ranges of motion from retraction to protraction. It also allows for acromial elevation. So as you move your arm, there's no impingement. Finally, it is a link in the kinetic chain, the coupled motion from the foot to the hand of force generation and force production. This clinical pathway demonstrates the 3 steps to complete the comprehensive exam. We will spend the rest of the time now on the exam illustrating the part 3, how we evaluate the causative factors. This patient has had a history of problems in his left shoulder for about 2 months following a traumatic injury. He's had trouble with forward flexion, overhead position, and pain in the arm. So we'll start in the exam from the ground up. We'll look at the ability of the hip and core to maintain stability. So Zach, what I want you to do is to stand with all your weight on your right leg, raise that up off the ground, and do about a half squat down for me and back up, and do the same thing with the left leg. That's good. And you see there's some loss of control of the hips there, indicating that probably the core is a little bit weak, and we can start there with some of the exercises we want to do. The next is we're going to look and see how well he does to retract the scapula back voluntarily. So, Zach, I want you to just pull your shoulder blades like you're pinching them together.
Hi, everyone. My name is Aaron Shasha. I am the director of the Institute of Clinical Outcomes and Research for Lexington Clinic. Today, for this part of the examination, we are going to begin with the observational components, primarily looking at posture, but we'll also look at scapular asymmetry as well as muscle atrophy. And so where we will begin with the exam in the postural component, we need to understand that there are numerous techniques out there to try to quantify posture. The concern, however, is that although these techniques have been shown to have a decent level of reliability, there's not one standardized method that we tend to go with. So we're going to go more of the traditional route, which is going to be more of the qualitative approach. So we're going to just use our eyes to see if we pick up any deviations from what we would consider anatomic normal. So we'll begin the exam with the patient in the lateral position. And so we're just going to make note from the head down exactly what we believe we're seeing. And so if we begin at the...
My name is Tim Wool. I'm a professor in the Department of Physical Therapy. I'm going to go over palpation associated with a scapular assessment or shoulder assessment. So we're going to take a look at Zach. Zach's a nice, thin individual, so it's relatively easy to find bony palpations. First thing I want to look at is the clavicle. I'm going to focus just on his left shoulder. I would do this bilaterally. So as I palpate out laterally, the first thing you're going to tend to focus on is over here on the coracoid process and see how tender that is. Does that bother you and I poke on you? So the coracoid is attached with the pectoralis minor. Are you sore at all in there? No. Not too bad with that. So the short head of the biceps and the coracobrachialis come over laterally. So I'm going to work all the way out to the end of the clavicle over to the acromion.
My colleagues and I have really had a good time putting these together. Hopefully you all will have enjoyed this part of the series. And if you want to see the entire video and others in the series, they will be available at www.kiblerscapulasessions.com. Thank you very much for your interest and have a good day.